Hey LinkedIn, welcome back to Business Unusual, a show where we're talking about coronavirus and its impact on our work and our lives. I'm your host, Jordan Dahl, coming to you from my home in San Francisco. Today, we're talking about public transportation. How public transit has become an integral part of life in our urban centers and so integral to keeping our cities running during this pandemic. We're seeing that essential workers and our nurses and our doctors are using it to commute to work every day, taking subways or trains or buses. But revenue was already declining even before this pandemic. We have budgets that have been on the decline, and our aging infrastructure has ballooned costs. Now, what revenue that they were bringing in has plummeted along with ridership. That has going down anywhere from 50 to almost 90% in some cities. Here in San Francisco, BART is losing $55 million a month. In Brazil, they're losing $188 million every single day, which is just an astronomical figure. So there's a lot on the line here. But before you close your tab, we have something here for everyone because transportation is a massive industry. And whether you live in a large city or not, it has a big impact on our economy and on our states. It brings in tax revenue, it creates jobs, and it decreases our carbon footprint. So, what does the future hold for it? What will it look like when all of this ends? We have a great panelist of experts today to help answer that question and walk us through that. But first, I want to hear from you. What is going on in your neck of the woods? What has transportation traditionally looked like for you? And how has it been impacted in this pandemic? Let us know. And if you have questions about transportation, definitely chime in. We are going to get to as many questions as we can. I see we already have some people joining us today. Hi, Zana from Ontario, Roberto from Atlanta, and Claudia from South Carolina. That sounds very warm and very nice. Gary from Philadelphia, and Suresh from India. We have people from all over. Thank you so much for tuning in. I hope you get a lot out of today's show. And with that, let's jump in. I'd like to welcome our panelists. We have Natalia Quintero. She is a program director at NYC TransTech Lab, which aims to improve public transportation in New York City. And we have Sam Schwartz. He is the CEO of an engineering and planning company that works across the country. And finally, we have Julie Durazio. She is a senior vice president of WSP USA, which advises clients on transportation and infrastructure. Thank you all so much for joining us today. I really appreciate you coming onto the show. To start with, I'd like to give viewers a bit of an overview and some history of what was the state of public transportation before the pandemic started. Natalia, let's go to you.
Sure, Jordan, thanks so much for having me. So I would say here in New York City, just to share a little bit of context on the TransTech Lab. The TransTech Lab is a public-private partnership between the MTA, which is the largest public transit agency in North America, and the Partnership for New York City, which is an organization that represents the private business sector and their commitment to ensuring that New York City has an important and outstanding role to play in the world. And the TransTech Lab was really created because we've known for as long as New York City has existed that public transit is the beating heart of New York City. And in order to ensure a future in which the MTA and local transit agencies have access to the best resources and technology that is coming out from all over the world, the TransTech Lab is really a process where companies are able to work directly with public transit agencies and test their technology and really improve the way that we manage and run public transit in the city. So to answer your question, Jordan, in terms of what public transit was looking like before this, I would say that, with the leadership of Pat Foy and Sarah Feinberg and a lot of other people at the MTA, I would say that, the MTA has really stabilized and found leadership in New York. And the pandemic has really been a big curveball, but I think we've also seen the benefits of strong leadership in responding dynamically to, these very challenging times.
Definitely. So something else that we're seeing a lot of right now is companies all over in all kinds of transportation industries announcing new safety measures. Airlines are saying they're going to be blocking the dreaded middle seat. Cities are requiring people to wear masks. In New York City, they took an unprecedented move and they are closing the subway for several hours at night to do a deep cleaning. Is this what the new normal is going to look like? What other actions are being taken to help keep commuters and transit workers safe? Julie, I'm wondering if you would be able to speak to this.
Sure. As we've seen the COVID-19 go through the different cities and in different degrees, we've seen all of the transit agencies across the country apply what they believe is the best approach to keeping the cars, the vehicles, the stations clean for both the riders and their customers. But each were doing it a little differently based on what they knew how to do best. But what WSP saw was a lot of discontinuity in the approaches, and some transit agencies had some lessons learned that we thought could be transferred over to the other agencies. So we partnered with APTA, which is the American Public Transportation Association, which covers all of the U.S. agencies. And we worked with Johns Hopkins. WSP has a strong relationship working with Johns Hopkins, the Bloomberg School of Health in Baltimore. And we put together a set of guidelines that the transit agencies could go to see how to apply the CDC guidelines to the transit environment. Very difficult to do 6-foot social distancing, very difficult to apply a lot of the guidelines there. And you mentioned the aviation industry as well, having difficulties. So what I think the next step will be is seeing how we can help the transit agencies work with their local departments of health, and the departments of health who can work with them, working with the CDC, coming up with an approach that will give the credibility to the public that this is a clean, safe, reliable way of travel. The last thing we want to do, and I know you mentioned that people are thinking about driving as opposed to getting on transit. Well, you can't bring in 4 million employees into New York City via cars. It would just be an impossible situation. So we do need our public transportation system, and public transportation is, it should be eligible for all. It's for social equality. It provides people better access to schooling and jobs. So it is so critical to find the right way to move forward and restore service quickly.
Absolutely. And love that you're pointing out of how important it is that agencies are working together and not working in a bubble, and making sure that everyone is communicating similarly to how we are handling coronavirus at a national level, of making sure agencies are talking to one another and sharing the lessons that have been learned. Sam, I want to go to you next. Public transportation was given $25 billion in funding from the stimulus package, the CARES Act. Is it enough? What else should be done to financially help these services and make sure that they are still running and available for people?
Yeah, I don't think we can count on the federal government to provide all the funds that are going to be needed. There's going to have to be a combination of things. One of the things that I've pushed in New York City for decades now, which finally got passed, is congestion pricing. And I know San Francisco and Los Angeles and Seattle and a number of other cities are looking at that. We're going to need new revenue streams. And it could be through some kind of pricing mechanism, which, by the way, is used widely in most industries. You charge more for an airline seat typically during the holiday season than off holiday. We have hot lanes, high occupancy toll lanes in many states in which we charge people based on the amount of congestion. So congestion pricing is one of the revenue streams. I think temporarily we're going to have to do something that normally I would not recommend, and that's using capital dollars for expense. But for a year or two, we'll have to do that. We have to remember to start thinking long term. We can't think short term and say our transit system is not going to be ridden by people because of fears. many of them unfounded fears. So we have to start thinking, what are we going to be doing in the mid-2020s and 2030? The epidemic will be over. Decisions that we're going to make in 2020 are very important as to whether we have sound cities, whether we have cities that can function, whether we have safe cities. Frankly, it's 20 times deadlier to ride in a car than in a transit system typically. You're also much healthier if you're riding the transit systems typically, because to use burning more calories, more activity. When you look at the correlation, even in New York City, there's weak correlation between where people use a lot of subways and outbreaks of the virus. In fact, Staten Island, with very few subway riders, or Nassau County, or Westchester County have higher rates than we see in Manhattan, where almost everybody is a transit captive. So we need to think long-term and long-term funding solutions if we're going to get through this.
Yeah, there's so much on the line here, not just for the next year or two, but really looking further down the road of what is our world going to look like. And if you are just tuning in, we are talking today about public transportation and what the future might hold for the transportation industry at large across our country. We have a panelist of experts who are walking us through this. If you missed the first half, don't worry. We will be posting this on our LinkedIn editors page, and you can go back and watch. But I want to look at our comments and our questions and hear from you all. See, we have a lot of people chiming in today. We have Sana, who is saying that Walmart, Amazon, Target, Costco, all of these are essential workers. They are still going into work, but bus rides have been free, which is great. Naya is expressing a lot of concern about the New York City subway, saying that it will be impossible. Same with Mary in New York. And Bala is really concerned about social distancing in the underground, which rightfully so. How do you keep 6 feet away from someone when you are in a train? Syed says that he is concerned about the ride-sharing industry and their contribution to the transportation industry as a whole, which I think is a great follow-up. I'm curious about this as well. Sam, I wonder if we can go to you again about this. Cities were previously not super supportive of scooters and shared bikes right in the beginning. Do you see that changing after this? And are there other opportunities that might exist in this space that we're not already looking at?
Yeah, Jordan, I think cities have to really relook at their space. And if you go back 100, 120 years ago, there was far more area for pedestrians to walk, even bike riders. We didn't have the scooters in any kind of numbers back then. This is an opportunity for cities. But we have a conundrum right now. And the conundrum is more people will want to drive, fewer people will want to be in transit, more people will want to bike and walk. And you'll have the biking and the walking and the micro-mobility, the scooters, the bike share, all competing for the space that the cars want to have. I think we've got to come down on the side of the micro-mobility, come down on the side of the walkers, the bikers. And when it comes to the automobiles, we just can't handle those great numbers. How did we do it in past emergencies? After 9/11, people were afraid of the subway system and wouldn't ride the subway system. And after the Sandy, we had similar problems, and during transit strikes. The secret sauce that made it work each time were occupancy requirements. In the United States today, the average occupancy per vehicle is under 1.1, meaning we're pretty lonely out there. If we doubled up, we can cut the traffic in half. It's amazing. Overnight, New York City, San Francisco, Los Angeles, their traffic problems would disappear if we had occupancy restrictions. We've done it quite a few times here in New York City, and it's been like a miracle. So it's going to have to be occupancy restrictions and then reclaiming a lot of the space for pedestrians, cyclists, micro-mobility with fewer motor vehicles out there actually carrying more people.
Definitely. I know we have been shutting down streets here in San Francisco for pedestrians, and it's really been a game changer here. It's been so nice to just walk around in the sunshine and not have to worry about cars. Same in New York, giving people the space and the ability to get outside and some fresh air. Julie, you are also working on this issue. How are you discussing this with your clients, what conversations are you having? What questions do they have for you about some of these alternatives that might exist in cities, not only in the US, but really around the globe?
Right. So I think that, bikes and scooters and other means of transportation is a great solution. I think that if there's one silver lining that we can see out of this pandemic is how much the environment has improved with the reduction of automobiles on the highways. So it's something that I hope that the citizens embrace and want more of. We can make a difference for this planet. And transit is part of that solution, has always been part of that solution, getting large numbers of people in traveling. And I recognize what you mentioned before about, well, the safety and, you're underground and those concerns of, how safe can transit be. And I think that if you look at the frontline workers that you mentioned and medical facilities, there's a lot that we can learn from how those medical facilities are designed. Their ventilation systems have air changers to bring in fresh air that are much more frequent than we would normally do in the transit systems. They use antiviral surfaces. There's different ways to uh, reduce the exchange and again including seating less more distances between seating and there's ways that we can do and learn from the medical industry and perhaps bring that to the transit industry. Is that our new normal? I think it'll depend on what no one knows. Is there a second wave? Are there further epidemiology problems? These are the things that we'll have to watch. But I think this is a great way we should take this as an optimistic way of bringing some of these lessons learned and providing a system better for all.
Yeah. And we're seeing in the comments that a lot of people are really agreeing with you and they have very similar concerns, very similar questions. Bala says, I agree with Sam. The future of commuting is at stake here. Amy is again expressing some concerns of saying it'll be a while before she feels comfortable riding the subway again. Perhaps a long while. Natalia, this got mentioned earlier in our conversation about affordability and how important public transit is for workers being able to get into the workforce and providing this economic opportunity for them. And during this pandemic, watching essential workers commuting has revealed some really glaring inequalities in our system. What do you think that transit agencies can do to help make transportation more equitable?
Yeah, I mean, I think that's a great question, and one of the things that I think so many people love about New York is that, in many ways, having a very strong public transit system has been the great equalizer, in your ability to access any part of New York at any time, by just being able to get there and seek out opportunity. So, I agree. I think that this is a really special moment to rethink a lot of the ways that we have gone about doing things. And really what I see is just a lot of opportunities to evaluate how we are collecting data, data on bus usage, on subway usage, and how we can leverage that information to better serve the communities that need them. We found in this process that that we don't necessarily know where essential workers live and where they work. And in a future where we want to have more dedicated service that, serves the needs of specific communities, I think, there will be a lot of opportunities to rethink how we collect data, how it's aggregated, how it's anonymized, and how it really serves the public in really special ways. I think to echo what Sam has said, I think that there is a lot of really special opportunities on bringing the streets back to pedestrians, and investing in micromobility. And I think we've seen a lot of the changes already, with the subways not operating from 1 to 5 a.m., to invest in the safety of subway users and ensuring that they are sanitized every 24 hours. We're also now seeing an increase in bus usage and implementing best practices there in rear door boarding and in leveraging the data that we do have access to serve specific communities of essential workers that need to get to their jobs. So really what I see is, in the midst of very difficult circumstances, a lot of opportunities for creative thinkers and public transit agencies to work together to, come out of this with an improved public transit system.
Great. If you are just tuning in, we are talking today about public transportation. We have a great panelist of experts who work across this industry, across the US and really around the world, and they are giving their insights into what this new normal might look like. So far, we've been talking a lot about New York City, about some of our larger cities, but there's also a lot at stake for smaller towns and smaller cities in the US. We have quite a few people joining us from those areas. We have Julie, who says in Iowa, you can't even get to the city without a car. And the few buses that do run don't run enough buses, or the hours aren't convenient enough to be able to ride. And Juliet says, you are talking about large cities. In smaller cities throughout the country, those ideas won't work. Now, I'm originally from Colorado, and we had these same issues there of if you wanted a job, it was even on the application, do you have a car, yes or no? And if you didn't have a car, you very likely weren't getting the job. And there's not a lot of buses, at least when I lived there. There wasn't a lot of opportunities for this public transit. So most people were relying either on walking, on biking, or most frequently on having a car. So what about these smaller cities? What of these ideas might work, and how can we improve our infrastructure there? Sam, let's go to you for this one.
Sure. We're not going to change the habits of people in smaller towns, smaller cities, rural areas overnight. But there is an opportunity ahead of us to get things right. Now, while it's true that 95% of the people in many of these areas are using automobiles, there are people that are left out, often low-income people, people of color, people with disabilities, people who may be too old to drive. There's a technology out there that we should be thinking hard at for those people. And it's combining micro-mobility vehicles with autonomous vehicles. And it could either be on set routes, or it could be on routes based on demand. And suddenly we could increase the frequency dramatically in transit, which is a big probable problem in some of these low density areas. So I would say for many of these communities to start thinking of transit in a different way. It's not going to be a subway, obviously, probably won't even be a streetcar. And don't think about that lumbering old bus, which comes every 30 minutes. Start thinking about smaller transit vehicles, perhaps every 10 minutes. But it's a long-term strategy. We're not quite there yet, and hopefully we will be there by mid-decade.
Yeah, it's a great point about learning from one another and seeing what else works. And I'm curious about what is happening in other communities around the world, in other countries, and what lessons are being learned there that might apply to what we're doing here. Julie, have you worked on this issue? Can you speak to this at all?
Very much so. So WSP has, the way they are organized is they have national markets and along with their local business units in each of the cities and regions. So I'm in the national market, and I have about a team of about 400 people that are just specialized in transit and rail, subject matter experts, train operation experts, and we are able to be deployed all around the US whenever a particular issue or project is required. But we also do that on a global level. And once a year, each of our national teams pick a spot in the world to meet and spend a couple of days together, getting to know each other, sharing some lessons learned, some interesting projects. And no more than now have I seen that global network that I and our team have is really proving to be just invaluable in trying to help each of these countries solve these problems. Australia has been looking at different ways of cleaning. We've been looking at Sweden and what they've put together. Even Wuhan Metro and how they restored service is a lot of best practices that can be brought perhaps here to the US. These fogging machines that they are now using at night seem to be a great way to disinfect and kill the virus on the subway cars. If you watch the news, at least here in New York, they did do the first 4-hour shutdown last night or the night before. And there was like 10 people per car doing cleaning. This is very labor intensive, and it's a burden on the operational costs for the transit system. So looking for those kinds of technologies that could be deployed, that can do this quickly and cost effectively is what I think we're going to be able to bring and share across the globe.
So speaking of new technologies and new innovations, we have a question from a member asking about what opportunities do you see for entrepreneurs to provide value within the public transportation sector now? Natalia, given your role with the MTA and TransTech, I'm wondering if you could speak to this about how you guys are working with entrepreneurs and how people who are passionate about this can get involved.
Sure. Yeah. I mean, I think, again, I would really just go back to the data comment that I kind of mentioned earlier. I think there are one of the least intrusive ways to collaborate with public transit agencies at the moment is to find data partners that have interesting information about where there are public transit needs and how we can better match that demand. I would say that that's one area. I think something that we've seen in the TransTech Lab already is, just actually leveraging existing technology partners that, we've brought in through the lab. So just to share one example, I think a really interesting company that has gone through the TransTech Lab is Remix. They have a software product that makes it extremely easy for operations and bus planners to draw bus routes and basically see the impact that those different routes have in a world where we are, dynamically creating new bus routes, altering existing bus routes to serve the dynamic needs of customers. I think that this is an example of a technology that already exists, is being leveraged in a new way and is actually being applied in New York City for the evening shutdowns for the cleaning measures. So I think there are a lot of opportunities for technology companies in particular to think about ways where they can either share existing data that they are collecting, we would invite you to go to the Transit Innovation Partnership website or the TransTech Lab website and reach out to us and let us know if you think that you have a solution that you think might be helpful to the reemergence of public transit in New York. We'd love to hear from you.
Sounds like a great opportunity for people who have some ideas and are at home and looking for something to do. Here is a way to get involved. Thank you all so much for joining us today. We have a ton of comments in the stream saying about how helpful this conversation has been, saying that you are all so essential to our workforce and doing such important work. So thank you so much for joining us and sharing these insights. We really appreciate it.
It's a pleasure to be here. Thank you.
Thanks for having us.
And thank you all so much for tuning in and joining us here today. We are going to be taking a break tomorrow, but we will be back again at noon on Monday, noon Eastern time here on the LinkedIn editors page. And we'll be coming to you live every day next week. So be sure to tune in. And thanks so much for joining.